Your blood type is way more than deciding who you can donate blood to, and most people do not have idea. So stick with me as we unpack the hidden power of your blood type. Now the first one we are going to be starting with is O positive. Now one of the most interesting facts about O positive is that O positive is one of the most common blood type in the world, and they are called universal donor for all Rh positive, which means that individuals with O positive can safely donate to A positive, B positive, AB positive, and even themselves O positive. Now, because of this wide range of compatibility, O positive are in huge demand in hospitals, most especially in emergency unit, trauma unit, and surgery ward also love O positive because they can be used for patients without any delay. And it doesn't just stop there. You see, individuals with O positive tend to have a naturally strong immune defense, and that is simply because they contain both anti-A and anti-B antibodies, which give them a broader protection against certain infection. And O positive blood type have also been linked to lower risk of developing severe malaria. And one case study found that people with O blood type had a 66% lower odds of developing severe malaria, which is very interesting. Now, the simple mechanism behind this is something called resetting. Now, normally, infected red blood cells usually stick to a non-infected red blood cell, thereby forming a clump or a rosette, which can contribute to the severity of malaria. But for people with O positive, they tend to form fewer clumps, they tend to form fewer rosettes, thereby lowering the risk of developing severe malaria, thereby preventing this parasite from contributing to severe complications. Alright. Now, the other interesting thing about O positive is that they tend to handle stress more better compared to other blood types, which is also very interesting. But O positive also tend to have weakness. People with O positive are more likely to be susceptible to H. pylori, which is the bacteria that is responsible for causing stomach ulcer or peptic ulcer. And personally, I am O positive, and then I have peptic ulcer, I have stomach ulcer, which makes it to be true. So if you are O positive, you are more likely to have peptic ulcer, and that is simply because of H. pylori's enhanced ability to bind to the epithelial cells that line your stomach wall, which is going to trigger inflammatory response, and then that is going to result in perforation in your stomach wall, which is ulcer. So O blood type is most likely to contribute to stomach ulceration. So that is one of the weakness. And next is O negative. Individuals with O negative are often called universal donor for all blood types, and that is simply because they can safely transfuse to any other blood type regardless of their ABO or their Rh factor, which makes them extremely valuable. But despite being a universal donor, O negative is one of the rarest blood type. Not many people have an O negative. And also, while sharing the same advantages with O positive, individuals with O negative only receive blood from O negative. They cannot receive blood from other blood type, and that is simply because their plasma contain both anti-A and anti-B antibodies, which is going to attack other blood types. So that's one of the weakness of an O negative. And the next we are going to be looking at is A positive. A positive is one of the most abundant blood type after O positive, which also makes them extremely important during an emergency situation. They can safely receive from A positive, A negative, O positive, as well as O negative. But they can only donate to a blood type that has A antigen and Rh positive. But one of the most biological features of A positive is the presence of this A-type glycoprotein on the surface of the red blood cell. Now, this A-type glycoprotein does not just define their ability to match with other blood, it's also very important when it comes to their immune defense. Now, some studies have shown that the presence of this A-type antigen on the surface of their red blood cell tend to act as a sticky landing for some bacteria or viral infection, which is the reason why people with A positive tend to be more vulnerable, tend to be more susceptible to infections like Staphylococcus aureus. All right. So this is one of the disadvantage of having A positive. And the next we are going to be looking at is A negative. A negative is one of the rarest blood type in the world, with only 6% of the world population having A negative. And they also tend to be more versatile than the A positive, and that is because they lack the ROH factor, which means that they can safely transfuse to A and then AB blood type. All right. But aside from this transfusion, they also share similarities with an A positive. And the next we are going to be looking at is AB positive, which is called the universal recipient, which means that individuals with AB positive can safely receive from any blood type, positive or negative. But one of the most fascinating things about AB positive is their immune profile. And since individuals with AB positive has antigen A and antigen B, their body do not produce A and B antibodies, which is going to attack them. So this gives these individuals a milder antibody response towards many external factors. Now this has advantage and disadvantage. Now the advantage is that their body is not going to be creating unnecessary immune reaction, which can result in autoimmune disease. So people with this blood type are less likely to have autoimmune disease. But the disadvantage is that they are more susceptible to viral or bacterial infection. And the last we are going to be looking at is AB negative. AB negative is one of the rarest blood type in the entire planet Earth, with less than 1% of the world population having it. Which means that if you are having AB negative, you are actually in the top rare blood elite. And because they are rare, they are extremely valuable. And then both AB positive and AB negative have disadvantages, like people who have this blood type are more likely to develop stomach cancer, pancreatic cancer. They are also very more likely to have higher risk of developing severe malaria. So this is one of the disadvantages of having AB positive and negative. So you can see that your blood type isn't just a label. It is a small part of your biology that influences your health, your immunity, and also how to save life. Now, if you want to see more of this content, let me know in the comment below, and also comment down below your blood type. Thanks for watching.